Okay, sorry for that interruption. Let's get back to that PowerPoint. And where did we leave off? Talking about high-risk pregnancy factors. Poverty, and that's a big one. Lack of family support, low level of education, limited foods, smoking, alcohol, drug use. Anybody that's younger than 15, I had a 12-year-old come in and give birth when I worked in Atlantic City. That hurt. That hurt. 12 years old. Because my first question was, who got you pregnant? Because if it was another 12-year-old, horrible, but if it was a 17-year-old or what, right? So you get the idea, right? Multiple pregnancies. The more pregnancies you have at a younger age, that also can be dangerous, right? So if you have 4 or more, for a mother that's 20 or older, that's considered a lot of pregnancies, right? And you can't afford 4 children, so don't have 4 children, please. No one can. Any previous history of problems, family history, of course. Twins or triplets can always be a high risk. Gestational hypertension or diabetes, or if you already have hypertension or diabetes or some other medical condition, all those things add to the risk factors. Okay, so what do you need nutrient-wise when you're pregnant? You got to eat right, and you're going to be eating more. Now, should you be eating 10 times more? No. I gained 50 pounds with my first pregnancy, 55 or 56 with the second, and 65 with the third. Now, again, lost it all, but that was a lot of weight. But I wasn't smoking or drinking coffee or using sweet and low, and I was drinking milk and I was eating well, and and I wasn't smoking, so I was just but that's not good. The average weight gain should be somewhere between 25 and 35 pounds. That's considered within the normal range. Carbohydrates necessary to fuel that baby's brain, about 175 grams a day is considered ideal. Protein, 25 grams a day higher than for non-pregnant women. Omega-3 and omega-6 fatty acids, you must get them. And, you limit your saturated fats, but that's whether you're pregnant or not pregnant. And again, when the baby's developing, the fetus is developing new cells, they're at an incredibly quick rate. That's the other thing, the way that fetus is forming, that's the proliferation rate of those cells is incredible. So you want to make sure that you're getting all the nutrients you need. Also, for the mom, changes happen in the body, like blood volume in the body increases, right? Sometimes later in pregnancy, women will complain about like edema around the ankles, those kinds of things, because you just have more fluid in your body. Neural tube defects can happen, and encephaly. Anybody know what that is? So if there's an A or an AN at the beginning of a word, it means without. Okay. Encephaly, cephalic, refers to the brain. It's without a brain. Yeah. Spina bifida. That's what I was talking about earlier. That's where a portion of either the spinal column or the column and the cord are outside the body. Meningocele or a myelomeningocele. You need folate. That's a big one for when you're pregnant and even pre-pregnant, right? Folic acid is very important for the nervous system development. Oh, there's even a picture here on slide 18 of spina bifida, and that picture is actually myelomeningocele. That's where there's a part of the spinal column and the spinal cord, and it's in like a bulla, like a blister, kind of looks like, and it's important to keep that intact, because if it gets damaged in any way, the spinal cord gets damaged. Baby can be paralyzed. Right? Okay. Yeah. So what do you need as far as vitamins when you're pregnant? You need B12, right? Because that's important for red blood cell production, et cetera, et cetera. If you're eating eggs, dairy products, and meat, you're getting what you need typically. If you don't eat animal products because you're a vegan, fortified foods, supplements may be necessary in that case. You need more calcium, for bones, teeth development. You are eating for 2. So that's not a lie. You're not eating for 10, you're eating for 2. Body conserves iron pretty well when you're pregnant, so you don't get a period, right? No menstruation when you're pregnant. the ability of your body to absorb iron even increases when you're pregnant, right? The body's amazing. I can't say this enough. Like, I've been a nurse over 30 years, and this is still fascinating stuff, what the body can do. Zinc, typically, intakes are lower than recommended because you get a lot of zinc from shellfish. A lot of people don't like shellfish or don't trust eating shellfish, right? Meats, nuts also have zinc. Prenatal supplements, almost always you will see a prenatal vitamin given, right? Just to be on the safe side. They're usually prescription. You can get them over the counter too. If the woman doesn't have a good diet, if she's carrying more than one baby, twins, triplets, whatever, if she smokes or she drinks or abuses drugs, she definitely should have a prenatal supplement, or maybe not be pregnant, but that's not my business. There are some food assistance programs this country has. There's one called WIC, Women, Infants, and Children is what that stands for. And it's, milk, formula, those kinds of things, vouchers for nutritious foods, those kinds of things. SNAP, food stamps is what it used to be called. It's called the SNAP program now. So if you have low income, you can get food stamps, to help with you with buying food. Let's see. Weight gain, here we go. Fetal and maternal well-being depend on weight gain. Should be a healthy weight when you become pregnant. And the recommended weight gain, if you really want to be specific, is based on pre-pregnancy BMI, right? Most doctors don't get that super specific. I wish they did, because they should focus more on prevention than on fixing things after they're broken. But, you want to, you're not going to gain 35 or 40 pounds if you're 4'10". You see what I'm saying? Right. So we look at the BMI at the pre-pregnancy rate. It's more common for people to gain too much weight than not enough weight. What a surprise in this country that is. There's a table here, recommended pregnancy weight gains based on your pre-pregnancy weight. So if you have a BMI that's considered in the healthy range, like 18.5 to 24.9, 25 to 35 pounds, right? If you're underweight, they go a little higher, 28 to 40 pounds. If you're overweight, here they say 15 to 25 pounds. I mean, probably 20 to 25 pounds, honestly. If you're obese, 11 to 20 pounds. I would argue that because you need a certain amount of calories. You just do for the baby to grow. They give you the impact of nutrition on, these different components of weight gain when you're pregnant. So there's more blood, breasts start to get larger. Mother's fluid volume in her body is increased. The placenta weighs a little bit too. You got to account for that weight of the placenta, the weight of the baby, the weight of the amniotic fluid. All those things play a factor. Certainly not 65 pounds, but, a portion of it. Let's see. Weight loss after pregnancy. This is the funniest thing in the world, because immediately after giving birth, you would think, well, at least I lost 7.5 pounds. Yeah, maybe. You're also retaining some fluid from that whole traumatic event. So sometimes you didn't even lose the whole weight of the baby, and you're like, what? But, you're not going to return immediately to pre-pregnancy weight. It takes a minute. Having a baby is a bit of a traumatic occurrence for the body, right? And if it's cesarean, it takes a little bit longer. 6 weeks, give or take, is the average recovery time, right? Most women, it says here, most women tend to retain a few pounds with each pregnancy. I don't know if that's true. I don't know where they got that information from. I would argue, show me the statistic that proves that. I didn't, and I have friends that didn't. So, body shape may change, right? I was like a size 4 before I got pregnant, but very straight up and down, you know what I mean? Skinny. And then I got some hips. I was like, yeah, I got hips, a little bit of hips. Yeah. So, but I don't know that most women hold on to weight after they have babies. I don't know. Stay active when you're pregnant. It improves fitness. It facilitates labor being easier for you, helps to either prevent or manage diabetes, reduces stress, but don't start a new exercise regimen when you're pregnant. So if you've been doing something, you can continue to do that while you're pregnant. That's fine, right? But you don't get pregnant and go, I'm going to start running and I'm going to run a marathon. No, you don't do that. Physical activity should ideally be low impact. Should, sports where there's a risk of falling, like don't go play football, swimming is one of the best exercises in the world for almost everybody. I can't think of anybody that wouldn't benefit from it because you're buoyant in the water. So there's no impact. Cardiovascular, right? You're getting all the stretching and all the increased heart rate, all the benefit without any impact on the ankles, the knees, so swimming is awesome. Water aerobics also. Physical activities, and this is everything that I already just said, so I won't repeat myself, warm up, exercise, do what you were doing before you were pregnant, but don't start anything new. Don't feel the burn because that's not healthy. That means lactic acid is starting to develop because of anaerobic respiration in the muscle tissue, right? You're not going to be, Miss America before you have the baby, right? After you have the baby, maybe. Food cravings and aversions. So a lot of women will say that they crave weird foods, right? Not everybody. There's no rhyme or reason. Some people say, well, if you crave it, that means your body must need it. I don't think my body needed a Dairy Queen Double Delight. I wanted one, right? I don't think it needed it though. So, there's not really any rhyme or reason to why people get cravings. But they do happen. I had them, a lot of people get them. And sensitivity to smells. I never had that. But some people will say, oh my God, is it coffee? Like if they smell coffee brewing, I've never seen a pregnant woman develop pica during pregnancy. I'm going to look this up. But cravings for things such as laundry, starch, clay, soil, ice. Now, ice, I've been chewing ice my whole life. Ice it's made of water and water's good for you. I don't go out and eat dirt. So, and I don't know I don't know what statistically the numbers are that reflect pregnant women that develop pica, but I am going to look that up because I want to know. Common nutrition related concerns, nausea. So morning sickness is common in the first trimester, first 3 months, but there is something called hyperemesis gravidarum, and that is where it's beyond just a morning sickness. It's, where they're vomiting and can't keep anything down, and oftentimes have to be hospitalized and need IV fluids, electrolytes, all that good stuff. So that's an extreme of it. Typically morning sickness, you wake up in the morning, you feel queasy, a couple saltine crackers, just plain crackers by the bed. You take a couple bites of them, that will usually help, right? Usually resolves by at least the very latest by the 3rd month, right? And then after that, it's clear sailing until the end, right? Heartburn. If you have heartburn, the baby's going to have a lot of hair. No, that's not true, right? You will have heartburn more than likely because you're carrying the baby here. Your diaphragm is here. The pressure of the fetus is going to push on your diaphragm, which is going to push on your stomach, which is going to push on that lower esophageal sphincter and force it open. And the acid from your stomach will climb up your esophagus and it will burn. Right? And that's it. Has nothing to do. I had 3 kids. One had a full head of hair. The other 2 were practically bald, and I had heartburn the whole time. So, there's no relationship between hair and heartburn. And constipation, yes, you can get constipated. She's like, yeah, I remember. Yep, that can happen. If you are diabetic before you become pregnant, it should already have been well managed before you get pregnant, but not that your sugars are all over the place, because that's going to make it even more difficult to maintain a healthy pregnancy. Gestational diabetes, it's when you develop it when you're pregnant. Sometimes if you get gestational diabetes, you might develop type 2 diabetes after the baby's born. Not a guarantee that you will, but you might. It does increase the risk. And you don't want that. Okay, so let's see. Hypertension, right? That's pre-eclampsia when you're pregnant. If it's the 20th week of pregnancy or later, pregnancy-induced hypertension. Having preeclampsia increases your risk for eclampsia, which is very severe seizures, can cause, premature birth, a lot of problems, right? What we look for is protein in the urine. That's one of the telltale signs. If your kidneys are not reabsorbing protein and they're spilling protein into your urine, that's a telltale sign that your blood pressure has been high for a sustained period of time, because hypertension beats the hell out of your kidneys. Right. So, yep. Let's see. And there are not vitamins in cigarettes, contrary to what you've been told. Cigarette smoking is toxic to the fetus. It's toxic to people, in case you didn't know it. It is a carcinogenic. We know this to be true. We just don't know why some people who smoke get cancer and others don't, right? But we do know it's carcinogenic. Nicotine itself is a vasoconstrictor. So it will constrict your veins and arteries, make them like a little tighter. So not great for circulation. Smoking can affect the fetus's lung development, right? And secondhand smoke or exposure even to chemicals in the air, which is just as bad, increases the risk of low birth weight and increases the risk of sudden infant death syndrome. Let's see. Practices to avoid. Medicinal drugs may cause serious birth defects. Every pharmaceutical medication out there has a pregnancy classification, A, B, C, D. So it tells you, is it safe to use while you're pregnant? Has it even been tested on pregnant women? Has it been tested on pregnant rats, but not pregnant humans, right? So there's a pregnancy classification in the drug book for every pharmaceutical out there. Over-the-counter drugs, you shouldn't be taking them willy-nilly anyway. So you should always get the advice of a physician. Herbal supplements may not be safe. What? Right? I say that a lot because people think it's natural, it's safe, not true. Right? And they should be avoided during pregnancy. Let's see. Don't abuse drugs. Abuse drugs. Here's the thing. Anything that you put into your body when you're pregnant crosses the placenta. There's nothing out there that I am aware of that does not cross the placenta. If it crosses the placenta, it's going to the baby. Plain and simple. And I worked in Atlantic City when crack was a big thing in the 90s. And those crack babies, they cried and screamed and screamed. It was heartbreaking. And I'm a nasty woman, not a nasty woman, but I'm pretty hard. That broke my heart. It was awful. I worked labor and delivery and NICU for 30 days. And I said, put me back in the ER. Can't take it. I couldn't take it. So how about that? Practices to avoid environmental contaminants. Back in the day, we had thermometers that were made of glass. And do you know what was in them? Anybody know what was in them? Mercury. And it was so much fun to break one accidentally. Whoops. Because mercury is an amazing substance, right? It's silver. It's a liquid, but it also, you can make little balls out of it. I've played with mercury from thermometers a lot. Because I was the kid that wanted to take things apart. I'm like, oh, how does that work? Look what that does. So every thermometer got broken, Turns out mercury is bad for you. Who knew? I didn't eat it, so that's a plus. And my brain is still relatively functional, I believe, so I think I'm okay. But lead and mercury are two substances that are very toxic to the nervous system. Used to be that we made paint with lead. And sometimes, my kids never tried to chip paint off a wall and eat it, but you never know. Little kids are just like, everything is like this,
And that's why I worked at Southern Jersey when I worked specifically into the assets. If they were under 2, we would test them for lead.
And it's funny because there are what are considered safe levels.
Yeah.
Right. Mercury is found in fish, right? Mostly the larger fish. So when you're pregnant, probably stay away from sushi and the larger fish. So here's some practices to avoid. Vomiting and diarrhea from food-borne illness may cause fatigue and dehydration. So do not eat bad food. Then there's something called listeriosis. It is an infection. I did not know that pregnant women were more likely than other healthy adult women to acquire it. So that's even news to me. See, you can always learn something. And listeriosis, I do know, as it says here, is dangerous when you're pregnant. It can cause stillbirth, and stillbirth is when the baby's born dead, right? Not a viable birth. Infections in the baby, brain damage, some really significant and bad outcomes. So you don't want to get an infection. Practices to avoid: vitamin and mineral mega doses. Again, there's no need for supplements. Restrictive dieting is always dangerous. Sugar substitutes are never good for you. Caffeine is not good for you. Alcohol, contrary to popular belief, is not good for you. Fetal alcohol syndrome looks very much like Down syndrome, right? The look of, I'm sure you've seen, right? The look of the newborn is very characteristic. You know, they look alike. The nuchal folds on the eyelids. Down syndrome, which is a trisomy, there's an extra chromosome at level 21. They will have one palmar crease, like we all have 3 creases in our hand. They have 1. Some very specific physical characteristics of Down syndrome. Fetal alcohol syndrome looks a lot like it. The eyes, right? The tongue is usually kind of hanging out of the mouth, right? So you can pretty much tell, but there are degrees of severity, if you will, you know, with them. But you don't want that to happen to your baby if it can be avoided, right? If there's a pregnant teen, adolescent pregnancy, they you know, our bodies, technically, kids are having what are called precocious puberties now, which means that little girls are 8 and 9 and getting their periods, which is young. Typically it was somewhere between like 10, 11 to like 14 was the average age. But yeah, 8-year-olds. How do you explain that to an 8-year-old? I don't know. So technically speaking, once you start to get your period, you could become pregnant, right? Your ovaries are releasing eggs at some point, right? Maybe not immediately, but somewhere within that first year or so, right? The ovaries will start to release eggs. So, you know, the younger you are when you get pregnant, if you're too young, it's just like being too old, right? As women, we're born with a finite number of eggs in our ovaries, right? All the eggs that we have when we're born, and every month, one of them, sometimes more in some people, right, that they have multiple births, but typically 1 egg from each ovary, and they alternate months. So like this month, your right ovary pops out a mature egg. Next month, your left ovary pops out a mature egg, right? The older you get, the good eggs have kind of already been released. The older eggs are still there. And if you're too young, pregnancy is hard on the body, right? It's difficult for a 12-year-old to carry a pregnancy for 40 weeks. You know, it's a 12-year-old body. So there are increased nutritional needs if it's somebody who's that young. Let's see. Breastfeeding. So everybody is recommending breastfeeding at least for the first 6 months. I mean, that's a very personal choice. I don't have a horse in the race. Do what you want. There is something called colostrum that's released from the breasts. It's the precursor to milk. It's like yellowy, and it's loaded with, you know, vitamins, minerals, protein for mom. So if you can at least do that, you know, that's kind of good. Formula is fortified with iron, right? So that's the only acceptable alternative to breast milk. Although I just found out from my son and his wife having had this baby last week that people donate their breast milk.
Especially someone who overlactates. Like there's people, women who overlactate.
I love you.
So instead of dumping it,
They donate it. Sure. Yeah. I mean, okay. Yeah, I don't know how I feel about it. No, I know how I feel about it. I'd rather not say. Yeah, it does. Well, they used to have wet nurses, right? So I don't know. Has anybody ever heard that term before? Right. So back in the day, you know, especially for the wealthier families, right? So you have a baby, well, you don't take care of it. You have the nannies taking care of the baby, right? And there was a wet nurse. There was one of the ladies would take care of the baby and she would breastfeed your baby for you. Right, right. And if there was a situation where mom wasn't making milk, right, you get a wet nurse in, breastfeed the baby. You got to make sure you're taking in ample calories if you're breastfeeding, right? Same thing. And same thing with breastfeeding. Anything that you eat, anything you put in your body is going into your breast milk, right? So, let's see. It says here, many women return to pre-pregnancy weight in 6 months. She said lies. Gradual weight loss does not reduce milk output. The one nice thing about breastfeeding is that it releases the body's own natural oxytocin, which is a chemical that helps the uterus contract. So your abdomen will go down pretty quickly, you know. It doesn't really have an impact on weight in general though, right? Because you have to maintain caloric intake if you're breastfeeding, so you're making enough milk to feed your baby. Let's see. Let's see. Don't smoke, because then your baby's smoking. Don't drink caffeine. Don't drink alcohol, because then your baby's having a cigarette and a martini just like you, and that's not good. Prescription meds. HIV is transmitted through breast milk, right? That's important to know. And tuberculosis, TB. Right? So it says encouraging successful breastfeeding. The number of infants who were never breastfed is increasing. I think that's a typo. I think they meant that the number of breastfeeding is increasing, not decreasing. They're saying the number of infants who were never breastfed is increasing. They're really pushy about breastfeeding. They are very, they will even guilt you. And it's not good, right? That's a personal decision. I didn't smoke. I didn't do anything when I was pregnant. When I had my babies, I'm like, they're getting a bottle because I need a cigarette. Personal choice. So let's see. And what else do we have? Encouraging success. And people say breastfeeding is easier. My daughter breastfed all 3 of her kids. Let me tell you something. I watched it and it hurt me. I was like, oh, geez. I'm sorry. I mean, it's still a lot of work for them to latch on, to make sure they got a good latch, and to make sure they're getting it. And you don't know how much they're getting. So you're always like, did they eat enough? And they wake up more frequently because, you know, your breast can't put out like a 12-ounce bottle of milk. Right. So breastfeeding is beneficial. So I'll give you some facts. So fact, a baby is born with passive, naturally acquired immunity from mom, right? And that means that whatever mom is immune to, baby is immune to, but it's going to wear off. It's good for somewhere between 3 and 6 months, right? So that's why we start immunizing babies, right? So because as that immunity wears off, they develop their own. Colostrum, the precursor to the milk, absolutely is like concentrated. That has a lot of beneficial things in it. But for many, many years, most babies were formula fed. Matter of fact, in the 70s, it's pretty funny. When babies were born, you know, back then there were diapers with pins. They were cloth diapers and they used pins to secure them because there wasn't Velcro. And you would wash the diapers. Wasn't that fun, right? Right. And the hospital would tell moms, you know, every 4 hours, give him a bottle every 4 hours. What if he's crying? Make sure there's no pins in him. And then put him back down every 4 hours. Yeah. So we've come a long way in a not very long period of time. You know what I mean? But there are pros and cons to both is what I'm saying. You know, if you are forcing yourself to do it and you don't want to, it's not going to work. Right. When I say you, not you, the proverbial you, the woman, right? You have to want to do that. I knew someone who breastfed her child till he was 6. If he can ask you for the breast, again, you know, teach his own. Live and let live. Let's see. And they do have lactation consultants in, and the La Leche League, that they will come and they will, you must breastfeed. You must. I mean, yeah, I saw them with my daughter was like, yo, chill, I'm breastfeeding. So I'm good. Yeah. Now my one daughter-in-law breastfed for about a week or two, and she was just having a horrible time. And I feel her pain. It's like, look, don't either. And the baby's absolutely fine. Now the one that just had the baby, she was adamant she did not want to breastfeed, and they gave her a difficult time. And I said, tell them to breastfeed the baby then. Because that's your choice, right?
And sometimes the baby doesn't even like running. Sometimes